Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Kindly like, subscribe and share. Your shoulder blade or scapula is a flat, triangular bone located on your upper back. It plays a vital role in the overall function and mobility of your shoulder. This bone is not only essential for the structural integrity of your shoulder but also serves as a critical attachment point for several muscles. The scapula connects your arm to your body, acting as a bridge that facilitates a wide range of shoulder movements. This connection is crucial for performing everyday tasks, from simple actions like brushing your hair to more complex movements like throwing a ball or lifting heavy objects. Strong muscles envelop the scapula, providing protection and support. These muscles work in harmony to aid in daily actions such as lifting, reaching, and pushing. They ensure that your shoulder remains stable and functional, even under stress. The scapula collaborates with the collarbone and the upper arm bone to form the shoulder joint, a complex structure that allows for remarkable range of motion. This joint is pivotal for the fluidity and flexibility of your arm movements. Scapular fractures typically occur in the body, the large, flat part of the bone, often resulting from strong impacts or trauma, such as falls or car accidents. These fractures can significantly impair shoulder function and require immediate medical evaluation. Other parts of the scapula, like the glenoid, which forms the shoulder socket, the acromion, the bony tip of the shoulder, and the coracoid process, a hook-like structure, can also sustain fractures. Each of these areas plays a unique role in shoulder mechanics. Fractures in these locations require careful medical attention and a tailored treatment plan. This may include immobilization, physical therapy, or even surgery, depending on the severity and specific location of the fracture. Proper treatment is essential for restoring full function and preventing long-term complications. High-energy trauma, such as car accidents, is one of the leading causes of scapular fractures. These incidents often involve significant force and impact, which can result in serious injuries. Falls, especially from a height or onto a hard surface, are another common cause of scapular fractures. The sudden impact can be enough to break this otherwise sturdy bone. The scapula, or shoulder blade, is a flat triangular bone that is well protected by surrounding muscles and tissues. It takes a considerable amount of force to fracture it, which is why such injuries are relatively rare compared to other bone fractures. In addition to high-impact accidents, contact sports like football or rugby, where players frequently collide, can also lead to scapular fractures. Severe muscle contractions, such as those experienced during heavy weightlifting, can sometimes cause stress fractures in the scapula. The most common sign of a scapular fracture is severe, sharp shoulder pain. This pain typically worsens with arm movement or when taking deep breaths, making everyday activities challenging. Additional symptoms include noticeable swelling and bruising around the shoulder area. These symptoms, combined with difficulty moving the arm, can significantly impact a person's ability to perform routine tasks. You might also experience a grinding sensation known as crepitus when attempting to move the shoulder. This sensation occurs due to the irregular movement of the fractured bone pieces against each other, which can be both painful and unsettling. Doctors start by examining your shoulder, carefully feeling for any abnormalities or areas of tenderness. This initial physical examination is crucial in identifying potential fractures or other injuries. They will also ask detailed questions about how the injury occurred, the level of pain you're experiencing, and any other symptoms you might have noticed. This helps them understand the mechanism of injury and the severity. X-rays are crucial for showing the fracture's location and type. These images provide a clear view of the bone structure, allowing doctors to see the exact nature of the break. Sometimes a CT scan is needed for more detailed images, especially for complex fractures. CT scans offer a more comprehensive view, revealing details that X-rays might miss, such as small bone fragments or the involvement of surrounding tissues. Ignoring a scapular fracture can lead to chronic pain, stiffness, and difficulty moving the arm. Over time, these issues can significantly impact your quality of life, making everyday activities challenging. The bone might heal incorrectly, malunion, or not at all, non-union, and nearby nerves or blood vessels could be damaged. This can result in long-term complications, including nerve damage, reduced blood flow, and persistent discomfort, emphasizing the importance of timely and proper treatment. Most scapular fractures heal without surgery if the bone pieces are aligned. Non-surgical treatment involves immobilization with a sling or shoulder immobilizer, pain management, and rest. Surgery is needed for displaced fractures, joint surface involvement, or open fractures. Surgical procedures often involve open reduction and internal fixation, or if, where the bone fragments are realigned and held with metal plates and screws. Post-surgery, rest and physical therapy are essential for recovery. Prevent scapular fractures by reducing high-energy trauma risks. Wear seatbelts, use safety gear in sports, and avoid serious falls. Athletes should wear protective padding and follow proper training techniques. If you suspect a scapular fracture, see a doctor immediately for early diagnosis and treatment. Early medical care ensures better recovery and prevents long-term issues. Your scapula is crucial for shoulder function, so protect it and seek help if injured. UMCC, your ultimate medical consultant connectors.